and welcome. Today, we'll explore LO1, understanding the development of international healthcare policy. We'll look at how global health strategies are shaped and the key political, social, and cultural factors influencing health worldwide. Pandemics and infectious diseases pose significant global challenges. Aging populations strain healthcare systems worldwide. Mental health issues are rising, yet services remain inadequate in many regions. Health inequities persist, with disparities in access and outcomes. Chronic diseases like diabetes and cancer are on the rise, demanding urgent attention. Healthcare systems vary globally, from national services to private sectors. Funding models include public, private, and charitable sources. Policies cover areas like vaccination, tobacco control, and breastfeeding promotion. Access to care, quality, and equity are central policy concerns. Global collaborations enhance healthcare delivery and innovation. Global health emerged as a concept in the 1940s. It focuses on issues with global impact, seeking worldwide solutions. The World Health Organization plays a crucial role in guiding global health. Dr. Chen emphasizes the need for specialized disciplines in this field. Educational and research institutions are key to advancing global health. Global health addresses medical issues with worldwide impact. Its main task is finding global solutions to improve health equity. Global health targets populations across all countries. It involves sectors beyond traditional health systems. Research and practice can be conducted locally, impacting global health. Global health has three main tasks: understanding global patterns, investigating influential factors, and establishing solutions. It aims to generate new knowledge and theories. Education and training distribute this knowledge. Applying strategies in practice addresses global health problems. Collaboration is key to effective global health responses. Policy formation in health is complex and multifaceted. National and international contexts shape policy priorities. Funding availability impacts the scope and quality of policies. Stakeholder influence can alter policy directions. Global trends and research inform policy adaptations and revisions. The UK bases health policy on national needs and global influences. Issues are identified through professional and public input. Data collection is robust, with international collaborations enhancing perspectives. Policies are drafted with stakeholder consultation. Implementation adapts international recommendations to fit national contexts. Funding determines policy, feasibility, and scope. It influences prioritization of health issues and service quality. Research and development rely heavily on funding availability. Training healthcare professionals requires investment. Technology adoption in healthcare is contingent on financial resources. The Health and Social Care Act aimed to decentralize health services. It increased competition and promoted patient choice. Critics argue it added complexity and risked privatization. The act influenced power dynamics and stakeholder relationships. It remains a significant and controversial reform in the UK's health system. COVID-19 highlighted the need for global health collaboration. Practical measures included lockdowns and vaccine development. Political responses were shaped by national interests and geopolitics. The pandemic revealed global inequities in vaccine distribution. It underscored the importance of international cooperation in crises. Lockdowns reduced virus spread but impacted economies. Vaccine development was rapid, yet distribution was inequitable. Travel restrictions controlled spread but disrupted commerce. Public health campaigns educated but faced politicization. Economic responses were crucial, but varied in scale and effectiveness. International collaboration was vital during COVID-19. Research sharing and medical supply distribution were key efforts. Coalitions like COVAX aimed to ensure equitable vaccine access. political tensions sometimes hindered global solidarity. The pandemic highlighted both successes and challenges in international cooperation. Evaluating health policy involves assessing outcomes and impacts. The Health and Social Care Act had mixed results. Localized decision-making improved some services. However, increased complexity and privatization concerns arose. Policy evaluation must consider both strengths and weaknesses. The future of global health depends on collaboration and innovation. Addressing inequities and improving access are key goals. Research and technology will drive healthcare advancements. Sustainable funding is crucial for long-term planning. Global health must adapt to evolving challenges and opportunities. COVID-19 taught us the importance of preparedness and response. Global health systems must be resilient to future crises. International cooperation is essential for effective responses. Addressing disparities in healthcare access is crucial. The pandemic offers lessons for improving global health strategies. In conclusion, international healthcare policies play a crucial role in shaping global health outcomes. Effective policies are driven by funding, collaboration, and innovation. By understanding the impact of global health initiatives, we can better tackle the pressing health challenges facing the world today. Should you have any questions, you're welcome to message us on WhatsApp at 07-48436-1688. See you at the next session. Thank you for your time.